So, definition. A procedure done by a nurse is ordered to assess the nose and sinuses. It includes the infection and palpation, the external part of the nose, the panoply of the nasal cavities, and inspection of the nasal activities. So the purpose is to determine a deviation from the normal finding and regarding the nose and its external and internal parts, as well as the tenderness and the sinuses. So the equipment are nasal speculum, pen light. So the consideration before, during, and after the procedure is to identify the patient, perform hand hygiene, and provide for client privacy and explain the procedure. So the things to document after the procedure is to document any findings and abnormalities.
Inspect the external nose. Note size, shape, color, and flaring or discharges from the nares. This is to check any presence of abnormalities and asymmetric discharge from the noses. Palpate the external nose to assess for areas for tenderness and assess the displacement of the bone. Instruct the client to close his mouth and include one nares and breathe through the opposite nares, just to determine the patency of the both nasal cavities. Repeat the procedure with the other nares, just to assess patency of the opposite nares. Use the nasal speculum and pen light to inspect the nasal cavities. This externally illuminate the cavity, elevating the tip of the nose, will assess for the discolored septal of cartilage. Hold the speculum in your right hand to inspect the left nostril and hold it in your left hand to inspect the right nostril. This to check to examine properly the inside of the patient nose. Ask the client to tip his head back, brace your index finger against the client nose and gently insert the nasal speculum about 1 centimeter in the nares. Open the much as possible. This is the widen prongs until the optimal view of the nasal cavity is achieved. With the pen light, shine it to the nares and inspect the nasal mucosa for color and edema and lesion inflammations and growth of discharge. Inspect the nasal speculum of the position deviation and interactions. This is to determine abnormalities. Gently remove the nasal speculum, wipe it dry with a tissue paper or gauze. This to maintain the cleanliness and to prevent the spread of microorganisms. Repeat on other nares. This to ensure the abnormalities. Palpate the maxillary and frontal sinuses to assess for any tenderness. Frontal sinuses. Shine the pen light against the inner aspect of the supraorbital ridge of the frontal bone. This to visualize the frontal sinuses and to determine any abnormality. Consider sinuses. Instruct the client to open his mouth and shine the pen light to the left and the right. This to check if there is inflammation caused by the virus, the bacteria, or fungus.